So to be able to measure if you're metabolically healthy or not, there are 5 basic measurements that are typically used. The first measurement is your waist circumference. So if people just take a tape measure and they go around their just above the level of their belly button, and they measure a little different than your pant size, and the cutoffs there are for women. You want that number to be under 35 inches. For men, you want it to be under 40 inches. And unfortunately, I don't remember the conversion. I know you have an international audience, but you
we'll
can,
put it
can
we'll put it in
convert
the
those.
description.
Yeah. So that's measurement number 1, easy measurement. You can take it home. And I think that's one of the most useful measurements for people to track. It's more useful than weight or body mass index. Waist circumference has a direct relationship to metabolic health. The second measurement that goes into determining metabolic health is your blood pressure. And if you're on medications to lower your blood pressure, that's already an indication that you're not metabolically healthy. And if you're not on any medications, you want the top number, the systolic blood pressure, to be less than 130, and you want the bottom number, the diastolic, to be less than 85. So that's measurement number 2. Measurements 3, 4, and 5 all require some blood testing. Number 3 is your fasting blood glucose level. And you want that to be, first of all, again, if you've already been diagnosed as diabetic, if you're taking any medications to lower your blood glucose, then you are not considered to be metabolically healthy. But you want without medications, you want your fasting blood glucose level to be under 100. And again, that's milligrams per deciliter, the United States units, and you can translate that to the international measurements. And then measures number 4 and 5 are both off a lipid panel, a cholesterol panel. You want to look at your HDL, what's called your good cholesterol. This, you want it to be higher. The higher, the better. So you're considered not metabolically healthy if you are female, if your HDL cholesterol is less than 50 milligrams per deciliter, and if you're male, if it's you're not healthy if it's less than 40 milligrams per deciliter. Women naturally have higher HDL levels than men. And the last measurement is your triglycerides level, which is one of the other numbers on your cholesterol panel. And you want that to be lower, and anything that is above 150 milligrams per deciliter is considered unhealthy. So those are the 5 measurements, and I suggest to everyone that you check, that you know those numbers. So if you go to your doctor and he's not checking those things, he or she is not checking those things, those are the numbers you need to know. And if all 5 of them are not in line, that's a warning sign. If more than 3 of them are abnormal, that actually diagnoses you with what we call metabolic syndrome. And metabolic syndrome puts you at high risk for developing these other chronic diseases that we worry about, things like heart disease and diabetes and some forms of cancer and Alzheimer's disease. All of these things have been associated with poor metabolic health.
And metabolic syndrome, we recently heard more about it in relation to COVID. So it must have a direct link with immunity.
Yes, it does. And as you mentioned, metabolic syndrome and some of the markers of poor metabolic health have all been shown to predict worse outcomes if you get COVID. And they've also been shown to increase your risk of getting COVID. So one of the things I recommend to people that you can do to minimize your risk from COVID is being metabolically healthy.
Okay.